talking with Dr. Arthur Evans, CEO of the American Psychological Association. Dr. Evans, you said that 40% of premature deaths are due to behavior. Explain that.
Well, one of the things we know is that a lot of what accounts for our health outcomes has to do with our behaviors, how we eat, what we eat, our exercise, a variety of habits and behaviors. And a lot of those are directly linked to various kinds of outcomes. And unfortunately, some of those have to do with and can lead to death.
How does effective treatment make a difference in behavioral health? And I'm speaking now about the number of days allowed by insurance companies.
Sure. So, one of the things we know is that the longer people get addictions treatment, for example, the better the outcomes. Pretty straightforward. And so it's really important for insurance companies to have policies that align up with what we know from the science and from the research in terms of how they set policies as opposed to setting them arbitrarily, and often based on financial decisions as opposed to the science and what we know works for people and what people need.
And how big a role do Medicare and Medicaid play versus private insurance in treating behavioral health?
Well, Medicaid and Medicare are the biggest payers of behavioral health care, Medicaid actually being the largest payer. And so what happens in Medicaid and Medicare is really important in terms of how this country then deals with behavioral health care issues. Medicare in particular is often the model for what people do in the private sector. So I think it's really important to know what happens in Medicare because of that, but it's also really important to know what happens in Medicaid because of the sheer numbers of people who get care through that program.
And explain parity enforcement in private insurance.
Well, the idea is pretty simple. If you have a benefit in a physical health plan, you have to treat people who have mental health conditions in a very similar way. And if you don't, you're in violation of the parity laws. And so people who are advocates, people who are consumers who are interested in people having adequate access to care really want to make sure that payers, public payers, private payers, are really adhering to parity because it's one way that we can ensure that those services are going to be paid for and are going to be available to people.
And what was your biggest success in your 12 years as Philadelphia's Commissioner of Behavioral Health?
I think our biggest success was really changing the way people viewed mental health and substance use issues. I think the fact that we were able to begin to address the issue of stigma and how people saw these issues, but more importantly, how people saw people who had those conditions. I'll give you one example. We had a recovery walk in Philadelphia that started with about 150 people, probably about 15 years ago. In 2016, the number of people at that walk was 26,000 people. It's the largest recovery walk in the country, and I think it's a good reflection of how public attitudes in Philadelphia changed. We also saw a major change in the way providers saw the people that they were working with. So, for example, when we started, very few people talked about people who had serious mental illness recovering from their illness. Today, if you go to Philadelphia, almost every provider will talk about their role as being helping people to recover, to get better, to have a meaningful life in the community. For me, that is extremely satisfying. And I think one other thing that I think I'm probably most proud of in the work in Philadelphia, and that is giving voice to people with lived experience. When people who often don't have a lot, people who've had very difficult lives, can say that they feel empowered, they feel like their voice matters, they feel empowered to take a stand on issues in ways that they didn't before we started that work, that's extremely gratifying.